Diego. Right across the street, Jesus and I have been attending past couple of days of the Low Carb USA conference. You might have missed it. Dave Feldman was on last night with us. We went out to dinner with him a little bit later. The youngsters would say he's going to drop some really good information in a couple of days about what actually causes plaque in people like lean mass hyperresponders, like Nick Norwitz, and Dave, people that have cholesterol levels 200 and 300. And I'm not talking total cholesterol, I'm talking LDL cholesterol. As many of you know from my channel, these people don't seem to be forming plaque. And again, really good information, great research coming out. They're working with a great cardiology researcher named Matthew Butoff. They've got a few lipidologists now that are joining the team. And really good information about, does LDL really cause plaque? Does it clog arteries? Now, David gave us some great preliminary hints last night. And if you think I'm going to spoil the beans, no, you're not going to get it from here. You got to tune in a couple of days and you can get it from Dave. But some really good information coming out, which is going to help. For those of us who are deep in it, you may say, well, why are you guys so interested in that? So let me go back and remind you of the implications. This is not just a storm in a teacup. It's almost every patient that we have come in says, all my doctor wanted to do was test my cholesterol, my bad cholesterol, my LDL, and give me a statin. And a lot of our patients have really high LDLs and don't want to take a statin. This information, if you find out that a population like they're studying with LDLs 250, that's what? 0.1%. 1 in 1,000 high levels of LDL, that high. And if those people are not forming plaque, what does that say about all the doctors in the USA and everywhere else in the world who are saying, let me measure your LDL and let me give you a statin? So again, it's a little bit of my rant for today, but Jesus has been beating me up. He said, look, Doc, you promised last week you were going to talk about exactly how glucose and insulin cause plaque. And I said, that's not what I promised. But he continued, he wouldn't let go. He would not let up. So last night I kept hearing about it till I went crazy. It's cyclic AMP kinase for you geeks out there, angiotensin 2,
angiopoietin.
Angiopoietin.
ADMA.
Yeah, ADMA.
NF, kappa B, decreasing nitric oxide synthase.
You see what
there you go.
You see what I got to put up with there. So anyhow, for the rest of us who don't want to geek out that much, here's the thing, and here's the concept to remember. Insulin, glucose stimulates insulin, and insulin is a growth hormone. Growing in cells in your body is just like growing a big city. What's the first thing you want to do? You want to lay down, you want to put down streets. What is putting down streets for circulation in a city? What does that got to do with insulin and glucose? Same thing. The first thing our body needs to do when we're growing is lay down arteries, lay down ways for our body to get supplies in and trash out, just like laying down a city. By the time we're middle-aged, most of us don't need to be growing anymore. So that's the problem. The way our diet has changed, especially if we're eating cereal every day for breakfast and now for dinner, our body's getting an overload of highly processed carbs. So it stimulates insulin, which stimulates inflammation in order to lay down new arteries. Why inflammation? Well, again, if you're going to take out the existing tissue, think about it again with the analogy of creating a city and putting in new streets. Let's say you've got a town and you need to put in a new highway. What is the first thing you got to do? You got to tear down all of those old places, those old buildings, those old walls, whatever, in order to clear the path to create new streets. Or new, the people that, when I was traveling a lot, I ended up going through the Big Dig in Boston several times. Major disaster for years while they were tearing up the town in order to create room for that new artery. So hopefully that helps you understand some of this analogy about how insulin and glucose are growth hormones, and the first thing that you have to do if you're a growth hormone is tear up some of the existing areas so then you can lay down arteries.
Dr. Brewer, quick question.
Uh-oh.
Can you tell them what pisses you off of doctors being too focused on LDL, ApoB? Number one. And number two, Agrippa Maxentius is concerned about high Lp(a). And we had two really good conversations yesterday on YouTube Lives with Dave Feldman and Dr. Ancona about both of those topics. Why don't you give your 5 cents on that?
That reminds me of the Einstein joke I just told you. I have to tell you the Einstein joke. Many of you have already heard it. It's like Einstein was going yet to another presentation, and his driver said, "Look, I've attended so many of these presentations with you. I think I could answer those questions." So Einstein said, "Okay, let's do it." They did it, and the driver did great. He pretended to be Einstein until he got to this one question, and he obviously didn't know the answer, so he said, "That question's pretty simple. I'm going to let my driver answer that." So Jesus, you want to answer your own question there?
Sure. Let me change the camera. Hey!
Right here in front of the Star of India. Did you get that in there?
Yeah.
There we go.
So let me tell you, what's the problem we believe has to do with all this stuff? One, if the doctors are just too narrowed onto LDL and ApoB, and the solution is, just like Peter Attia says, 4 medications.
Yeah.
With plenty of side effects, right?
Oh, I know what you're talking about. That does piss me off. Pardon me. Go ahead.
Well, it's your show. You do whatever you want. I'm going to steal from Dave Feldman. He got a really good analogy yesterday at dinner. He was like, imagine that you're blaming car accidents on the wheels of the car.
The tires.
The tires.
Yeah.
So you get rid of the tires of the car. That's LDL. No more car accidents. Is that functional? I mean, they have to do with it, but they're not the drivers. So who's the driver of that car? Who's the driver of that car of cardiovascular inflammation and plaque, Dr. Brewer?
So I'm gonna not even answer that question. But go in a slightly different direction. When you talk to Nick Norwitz and Dave Feldman and some of these folks, one of the things we were talking about last night is Nick and Dave are getting hammered. And to what Jesus was just saying, you'll never hear Nick or Dave say there's no contribution of LDL. And the reality is you'll never hear me say that, but that's another bunny hole for another time period. I was cutting up with Dave last night, and I said, yeah, you know what? I'm totally comfortable saying it because I'm not at the tip of the spear, but it is crystal clear. If LDL of 250 is not causing plaque among this cohort, the whole question becomes, why are you medicating people? I tried to get Peter into that conversation at one point. He had a good point. It's the point he says transparently over and over again on his shows, and that is, look, it's simple and easy to treat LDL and ApoB. We've got 4 medications to do that. All of that's based on the assumption that LDL is the problem. And how many folks watching, and how many of our patients, and how many of the population in this world go to their doctor with high risk for heart attack and stroke, number one killer and the number one disabler, and the doctor looks at LDL and gives them a statin. Meanwhile, if it was LDL, we've had decades of treatments with statins. We've had decades of treatments where we're hammering down that LDL. What have we done for heart attack and stroke? Nothing. It's worse, and it's getting in younger populations now. This is a lifestyle problem. It's a metabolic problem. Statins don't help metabolism. In fact, a high dose and medium dose statins make it worse. So, am I getting my point across?
Dr. Bruce, like, he has been on too much statins and he's forgetting what to say right now. I just want to give a quick shout out. Somebody mentioned Nick Norwitz in the comments. We have been having conversations with him. Check out our community tab or go straight to his channel. He published a new video and he's advocating for a metabolic army. Basically saying what you guys do all the time. Advocacy for your own health. Take health into your own hands and learn more about this and realize that metabolic health is the most important thing to work on to prevent clogged arteries, basically, right?
Yep, absolutely. Now, while we're at it, did we talk about we're here at the low carb conference?
Not yet.
Oh, so if you've seen, we've done several of these vertical lives over the past few days. And those are just sort of like scientists in the street at the conference getting information from Anthony Chaffee. His was a popular one.
Brett
Scher,
Dr. Ancona.
Dr. Ancona, Jesus and Dr. Ancona made announced, by the way, if you didn't see it last night, we've got some really exciting news. We're creating a Spanish channel, and you'll be amazed at how well my Spanish has improved when those come out. So we got a lot of good stuff coming on.
Okay, I want to digress a little bit.
Okay.
Lucian P, who is a frequent viewer, thank you so much. We have like 8 minutes still to go, probably. Do you want to go into that bonnet hole about high calcium score and what it means for cardiovascular disease?
Real quick, I know Lucian's a big supporter. Lucian, yes. What's that? Oh, so just real quick, we get these all the time. We get these people that come to us and I talked with one last night, a calcium score of over 2,000, and they're worried. And again, Jesus actually found this a couple of years ago, maybe 1 year ago.
Maybe 1 year ago.
Where these people with the calcium scores of 100 are more likely to be people that are just getting into this inflammation process. People with the calcium scores of over 1,000 are much more likely to have a much higher ratio of stable plaque to inflamed plaque. And we see this all the time. People start working with us and their calcium scores don't drop, they go up. Why? Because calcium is a clear biomarker that you have stabilized your plaque. This whole issue of plaque, and again, it's one of the core concepts in our channel, is a little bit more complicated than just going to get a calcium score, and the higher it is, the worse you are. It's not exactly that way. Anything to add to that?
Yes, I have an analogy for that I just thought about it. Going back to your building a street analogy. So there are 2 ways to build up calcium in your arteries. The healthy way and the unhealthy way. So let's think about, you have a lot of inflammation going on. You're trying to heal that inflammation, but still you have a lot of inflamed liquid on it. So the body's gonna try to do that automatically. And it's gonna create kind of islands of calcium. Like if you're revamping the street with batches of, what do you call that?
I think I'm lost.
Cement.
Maybe it's because I'm not listening.
Oh God. This is important life-saving information, you know. So basically, you have.
And you think I do bad?
Well, are you not understanding this?
Go ahead.
So patches
try again.
patches of calcium.
Yeah.
So it's not like you are putting the this what do you call it? Cement?
Yeah, cement.
Okay, they're
Or
not
pavement.
The pavement.
And
One
pardon
second.
us.
Pardon the ambulance.
Pardon.
Maybe a heart attack. Hopefully not.
Yeah. Unfortunately, it's dead serious, the kind of stuff that we're
Yeah.
looking to prevent.
That's the consequence right there.
Yeah.
So you're not putting a clear line of pavement. You're putting some pavement here, some pavement there, but it's still a lot of inflammation, so it's not effective. But that's going to increase your calcium score either way.
Yeah, I just
Now,
got the analogy.
get rid of that inflammation first.
Yeah.
You're going to have a smooth soil over which to put the pavement, the calcium on it.
So if you complete the whole street, you're going to have a lot more calcium there.
It's going to be more stable.
Clean the street up, it's stable. I get it. Yeah, that's a good one. Rather than having this street torn up and that street torn up and that street torn up and that street torn up, you've got one area where you had plaque, you've gone through it, you've cleaned it all up, it's stable.
Less car accidents, I bet.
And
Less car accidents.
And if you don't believe us, go back. We can. You can call us or write us, and we'll give you access to that. The Honda study. The Honda study is very, very clear. Not Honda cars. There's a researcher, I think in Oregon, named Honda, who actually looked at optical character recognition and showed this is not subjective. This is very, very clear. You can do it with automated systems to see just how much calcium is in a plaque, and the stability. Once you start calcifying, it gets to almost the stability of having no plaque. So,
if you like cars, when's the last time you saw a Ford promoting a Honda? Ever, right? First time ever.
and he thinks I'm bad. So what else did? The other thing.
Yes.
I will tell you. Here's what I thought I promised at last week's rant. I thought what somebody had asked from the very first rant. You started talking about resistance. What is that, and how does that mechanism work? So here's the thing. You think about a fat cell. A fat cell has what it does. It pulls in glucose from the. You're going to check and see if there's.
I don't want to lose your
Okay.
make you lose your flow. Go ahead.
So think about a fat cell. A fat cell takes excess energy in the form of glucose out of the blood. It brings it into the fat cell. It turns it into a much better source of energy, which is fat inside the cell. The fat cell, it should not get too big. When fat cells get too big, they start causing problems, multiple problems with metabolism. So the fat cell has to have a mechanism to shut off or shut down. It does. It has a mechanism to shut down. The mechanism is a thing called resistin, and there's a couple of other hormones, but resistin is a hormone. The hormone does exactly what the name implies. It resists insulin. So in other words, that fat cell that's getting too fat, beyond capacity, starting to smoke, get oxidative stress, it starts to shut down by saying, I'm not bringing any more glucose in, I'm not making any more fat, I'm not going to expand, can't do that anymore. So that works very well for that one fat cell. Now here's where the problem comes in. It's a hormone, so it doesn't work just for that fat cell. It works for every fat cell in the body and the muscle cells and the liver, and that's where the problem comes in. Now you have insulin resistance with your muscles, your fat cells, and your liver. And that's what's killing and disabling most of us. So someone asked about that last week, and I wanted to promise to get a little bit deeper into that mechanism.
All right. Want to address calcium score of 0, because that's the other side of the story. Somebody asked, okay, so is a calcium score of 0 actually a good thing or not?
Well, yes, and I'm going to do what you always hate about me doing. you ask a simple question, I'm going to maybe go too deep. But so um, we've always said you don't need a statin if you don't have any plaque. And up to about about 3 years ago, obviously the Standards Committee for the American Heart Association did not agree. Now, they said, you know, if you've got an LDL of 120 or higher, you need to take it. But then they changed and they went our direction. They said, you know what? If you don't have plaque, you don't need a statin. And how did they define it? Unfortunately, they screwed up again. Because what they said was if you have a calcium score of 0. Now, who asked that? Was that Lucian?
Sorry, Gail probably.
Okay, so anyway.
Somebody else. Thank you so much for asking. I'm sorry. Really bad with names. Anyhow, Gray State.
So Gray State. So here's what happened. Here's the problem with a 0 calcium score. And the problem with calcium score in general. It only looks at calcium. And the problem with calcium is calcium doesn't get deposited or form in the artery walls until you're starting to heal that plaque. If it's just soft, inflamed plaque, you don't get calcium. And so those of us who look at plaque that deeply have often wondered, is there a problem there? What about people who are just starting down this plaque forming process and they have nothing but soft plaque? Do they have risk? And the answer is, we wondered about that until about 2 years ago. And then 2 years ago, there was a study looking at exactly that. And guess what? Yes, there's risk there. So don't just trust a negative calcium score. I wouldn't. And don't think, okay, I've got 0 plaque. You might want to do a couple of other times, or at least one other kind of checking. I got beat up yesterday for talking about CINT by one of our cardiologist buddies. And bottom line, that's why. You got to know a little bit more about plaque than your typical cardiologist, or you're going to leave some people at risk.
One comment. We put out a short this Monday. The short is called "Do this test if you have high cholesterol," and we said do a calcium score. There's a clear reason for that.
Oh yeah.
Why is that? Because now it seems like you're beating up on calcium score.
Yeah.
But we're recommending a calcium score. So what's this about?
So we did. We already got some questions about that, and when Jesus gave me that script, I said, and then I realized, the bottom line is, any focus, any better knowledge on something like plaque is critical. So yes, we use calcium score a lot, and the whole point behind using the calcium score is to be able to find something quickly. I could find a calcium score within 5 miles of here. Like anywhere in the U.S., you can get those. CIMT, and especially a good CIMT, you can't find so well. I mean, I've got people that schedule in northern New York that schedule their CIMT once a year in South Florida because they happen to be going down there. We had somebody who traveled the better part of a day a couple of weeks ago.
We had somebody traveling like 14 hours.
Yeah, and I don't know that I would do that today to get a CIMT, but again, I wish things were simpler. I wish that we only had one test. I wish it was available right across the street for everybody in the U.S. But unfortunately, reality is often not simple.
Definitely. Somebody asked in the comments, what if I want to become a patient? See the description. We have a link, prepmedhealth.com, or call 859-721-1414. You can reach out to the team. And remember to look at Nick Norwest's channel. We're going to have him next month. Probably Dave Feldman as well, so wait for that. They're going to be talking about the results of the study where they compared 100 people with lean mass hyperresponder, metabolically healthy people with high LDL, see if they develop more plaque compared to people from the Miami Heart Study, which are not metabolically healthy per se, and that's going to be interesting to see.
So I see Bart commenting about you shouldn't do HIIT every day. That's absolutely true, Bart. You know, we get some patients who are saying, you know, I'm getting in better shape, and I, rather than just doing HIIT 2 or 3 times a week, I'm now doing it 5 times a week. Don't do that. Like Bart said, here's what I do. I do 1 session of HIIT, you know, full HIIT, where you do like the full minute of intense phase, and do 8 to 10 of those. But then I do 2 or 3 sessions of re-HIIT, which is much shorter, a little bit even higher intensity, but like 20 seconds intense phase, only do 2 of them. You can knock out a re-HIIT phase in about 5 minutes. You know, I can do that between patients. We're not going to go much more deeply into that, but that's why Jesus and I are out here. We just did a short, it was sort of in between re-HIIT and HIIT. And Jesus did very well.
Dr. Brewer is not bad for a 67-year-old man. Let me tell you that. He was able to keep up with me. So
oh no,
that's why.
I dusted you. You're great. Anyhow, so now we got to go across the street and do a little bit of resistance training.
By the way, wait for more of these videos today. We're going to be interviewing more people from the Low Carb USF conference. Probably Dr. Saivas is going to be there, Adrian Soto, and maybe Paul Mason. I don't know. We'll try.
Oh, and
we'll try.
Hopefully, Doug.
Doug Reynolds, of course. We're gonna try it. We'll let you know. Just keep
Doug
watching.
is very busy. Doug runs the program here.
Yeah.
And it's a great story. Hopefully we can get him, and hopefully he'll get into his personal story. There's been a whole lot. Jesus says, don't mention this board because nobody cares, but I'm going to mention it anyhow because I care. There is a huge connection between a metabolic health and mental health. And the whole discussion last week, yesterday afternoon, was just that connection. A lot of psychiatrists, mental health providers, talking about getting people on keto diet and curing anxiety, curing depression, and
anorexia,
anorexia, just a whole host of mental health problems. So, again, there's a whole lot to this that, unfortunately, most of your doctors still don't understand. I see a lot of people attending today. We do know this. This is a totally different format, this vertical live for YouTube. And we're watching the AI, the algorithm, trying to manage this. We're getting some people coming in from India and Africa, and we've got a lot of followers and patients that are interested and actually come in from that area. But just be patient with this format. Hopefully it'll continue to provide ways for us to get information out quickly.
All right. Well, this started as a rant and now became a lecture. So let's get over with it. Send us in the comments if you want any topic you want us to cover. Next week we're going to talk about sweeteners. So be at the lookout for that. All right.
I got a rant about sweeteners.
Oh, we can do a rant about it. Okay.
Yeah. Okay. Thank you.
See you later.
Wait a minute. Don't let Tony the Tiger take over dinner.